Hi, I'm Rich Daly, and this is Fast Finance, your quick hit of the news and numbers that matter the most in healthcare finance. Up first, weird numbers. $1.3 billion. That's the amount of Medicaid funding CMS announced it was withholding from the state of California as part of the Trump administration's ongoing healthcare fraud crackdown. Now for today's main story. Amid rising bad debt, health systems are improving front-end collections. That's according to a new survey. Free-service collections as a share of self-pay collections have improved from an average of 16% in a 2025 survey to 21% in 26. That signals that more organizations are capturing revenue successfully before care is delivered, and that's according to the survey of 205 healthcare revenue cycle leaders by Payzen and HFMA.
For the health system, it's also pretty clear if you consistently deliver a high-quality estimate, ask the question, how would you like to pay, and give options along with that prior to someone coming in, your probability to get a payment's much higher.
That was Tobias Metzger, a founder and chief revenue officer of Payzen, a healthcare technology and financing platform. The survey also found the share of patient collections tied up in open payment plans decreased from 30% in 25 to 23% this year. That finding is complex because the increasing financial pressure most health systems are facing has led many to carve back the payment plans that they had offered to patients.
It depends, I think, case by case. I think if a health system is carving back what they offer in-house, but they're bringing in a partner, I think it's overall good news for the patient, especially if it's the right partner. Think if the financial pressure on the health system is so big that they have to carve back what they offer their patients, but without an alternative, I think it puts patients into a tougher spot.
Overall, health systems reported in 2026 that they collected 31% of total patient billings. That was an improvement from 24% of total patient billings they reported collecting in 2025.
There's more focus on patient affordability and more focus on patient payments. I think that's what you see here. I think we've, in even last year's survey, seen that the larger health systems or more forward-thinking health systems had these higher payment rates. And I think you see now kind of the whole market just paying more attention to patient payments and patient affordability.
The survey results come as hospital financial tracking from Strata Decision Technology reported front-end patient collections have improved over the last year, while back-end collections have faltered.
Some of it is just the substitution effect, right? If you collect it up front, you're going to not collect the same amount in the back end. So I wouldn't say we see across our customer base and people we talk to that back-end collections are decreasing, but I think overall patient responsibility is increasing. So even if the collection rates, roughly the same, 30% still not a great rate for a health system for something that's now a bigger share of their revenue. So there's still a lot of opportunity, I think, throughout in the front end and the back end.
As finances tighten for both patients and health systems, those organizations will need to keep pushing for ways to provide more financial information and options for their patients. And now before we go, just one more thing. A proposed rule would implement $510 billion in federal cuts to state-directed payments over the coming 10 years. That would be a 39% cut in the projected $1.3 trillion in federal spending on state-directed payments over that period. The rule would implement cuts required under the One Big Beautiful Bill Act, or OBA. However, its scope expanded beyond that law, which was estimated to cut only $149 billion in federal spending over that 10-year period. The rule includes an interpretation of OBA that will accelerate the start of limiting SDP payment rates to 110% of the Medicare rate in Medicaid, non-expansion states, and 100% of Medicare in expansion states. The rule's approach would ensure that SDPs reach those maximum payment limits within 10 years, as opposed to another approach discussed They would have allowed higher rates for as long as until 2075. The proposed rule also would bar, starting in 2028, most uniform increases in SDPs. Instead, CMS could link payments to specific performance metrics, financial data such as the amounts of uncompensated care, or certain service lines. The rule also would require that, starting in July, states submit SDP preprints to CMS before the start date of the SDP agreement, instead of the current process, which allows retrospective SDPs. Comments on the rule are due by July 21st. Well, that's all we got for today. Don't forget, you can get your Fast Finance newsletter delivered right to your inbox every Wednesday. Sign-up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.